Adult BMI, UDS requirements, and how to meet them. What UDS requires. Patients 18 and older with a documented high BMI must have some sort of dietary or weight counseling. The measures are 18 to 64. If the BMI is over 24, it's considered high. If they're age 65 and older and the BMI is over 30, it's considered high. UDS requires that counseling must be done at the most recent visit or within the last 6 months prior to that visit. Charts are audited for this measure electronically. Hand audits are no longer allowed by UDS. The electronic reporting system, called Bridget, will look for flags in the progress note that indicate that the needed diet weight counseling was done. What the UDS audit looks for: a documented BMI out of range and one of the following flags in the same progress note. An assessment code of Z71.3. It does not need to be primary. Or a specific structured data section in preventative medicine. Adding a flag in preventive medicine. There's a template that can be saved to your template tab in the right-hand chart panel that will add the needed information into the progress note to get credit. This is going to be the easiest way to do. Simply by checking on the arrow, it will pull over a generic assessment for obesity plus the needed flag, which is this section here, into the progress note. Let's see how this works in real life. Okay, first off, here's a patient. I've entered in my vital signs, and as you see, the BMI is highlighted. ECW knows the criteria, so a patient 18 to 64, if their BMI is over 24, it's going to be flagged as high, and here it is being flagged in red. Okay, in 2 clicks, I can quickly add the BMI counseling template. I just click here on my templates tab, and I've saved the BBCA adult high BMI template to the section. If I click on the arrow, it will populate into my chart the generic assessment, the needed flag that the report's going to look for, plus a little verbiage to go along with it. So once again, to get credit, I got to have a BMI out of range and this section here. Okay, let's look at how we can add a different flag in the assessment of the progress note. The assessment code is Z73.1 will also act as a flag for the UDS report. This is to show that the counseling was done. Using the same template, if I click on the plus sign, it'll open up an order set that allow me to drop in the assessment code and the option of documenting any handouts I've given for getting meaningful use points. Let's see how that works. Okay, once again, I'm in the progress note, and I can see for this patient, my BMI is in red because for this age group, it is high and it's been flagged in ECW. Now, if I go over here to my right-hand chart panel under templates, here's my template, adult high BMI. This time, I'm going to want to add an assessment. I click on the plus sign. Here's my order set. Click it and scan down to the bottom, and here's my link assessment. If I click the assessment, add DX only, it will drop in my assessment. Let's look at that another way or another option of doing that. If I click on the plus sign, open my order set, and select my assessment, and then hit the OK button, I'll get an actual order set that opens up. And listed here are a list of possible handouts I can give. I don't need to print these out. It's just a way to quickly document handouts that I have given. So I'm going to give out this handout and this handout. If I scroll down, I have pre-built in a little narrative that can go along. I just click one of them and hit order. And what I've done is I've added the assessment. This is the flag that the UDS report's going to look for. And then I've preloaded here some notes. Here it shows me what handout I gave, and the little narrative came in also. So it's a very quick way to meet your UDS requirement, document any handouts you're given, and get you some meaningful use points also. Points to consider. Counseling must be done at the most recent visit or within the last 6 months prior to that visit. Diet weight management counseling can be initiated and completed by the nursing staff. Pre-selecting handouts can speed up counseling. If given to the patient when nursing staff leaves the room, patient can be reviewing the handouts while waiting for the provider. Adult low BMI, UDS requirements and how to meet them. What UDS requires. Patients 18 and older with a documented low BMI must have some sort of diet or weight counseling. Here's the requirements. If they're 18 to 64, their BMI is considered to be low if it's less than 18.5. If their age is 65 and older, their BMI is considered to be low if it's less than 23. Like with a high BMI, counseling must be done at the most recent visit or within the last 6 months. What the UDS report looks for. Just like for the high BMI, the low BMI report is looking for the same flags in the progress note. A assessment code of Z71.3 or a specific structured data section in preventive medicine. Once again, these are flags that tells the report that the education was done in those particular progress notes. There's a template for doing the low BMI education. It can be saved into your right-hand chart panel under the templates form. Once again, when you click the arrow, it simply brings in an assessment of low weight. It brings in the flag plus some narrative about some diet recommendations. It works the same way like the high BMI, that if you click on the plus sign, you'll get the options for the order set and handouts.